Hi, everyone. I'm WKYC TV senior health correspondent Monica Robbins, and joining me for a roundtable discussion on the future of healthcare in the current and post-pandemic world are three leaders of our biggest healthcare institutions. Dr. Tomislav Maholovic is president and CEO of Cleveland Clinic, Dr. Cliff Megarian, president and CEO of University Hospitals, and Dr. Akram Boutros, president and CEO of MetroHealth. Doctors, I know how incredibly busy you are, so I can't thank you enough for taking the time to chat with me about this. This is something I had planned a year ago, and COVID got in the way. So I'm so grateful that you found the time to be able to do this with me today. Dr. Maholovic, I want to start with you. It's been a year since the COVID-19 pandemic began. From your perspective, can you describe the lasting changes in healthcare, both good and bad, and what we all have learned?
Well, let's just start with the good changes in healthcare. And probably the most profound change in healthcare is very many healthcare organizations, just like ours, here in Cleveland are working much closer together to the benefit of the communities and the patients we serve. Another big positive change in healthcare is that the acceleration of new knowledge and our ability to find cures for new disease has sped up immensely. So that's the third change. And the second change, and a third positive thing is that I think we're now having a really strong realization around the world that in order for to keep ourselves healthy individually, that our communities have to be healthy, that every person in our communities has to be healthy as well. So that importance of community health is really what comes to mind. You know, what are, so to say, the bad experiences during the COVID pandemic? I think it's just a humbling understanding and realization that the new onset of infectious disease can paralyze the life in an entire globe. And that is really what is very, very sobering. It underscores the importance of our joint effort to combat new pandemics for the benefit of the humanity. So I think if I were to summarize it in few sentences, that is what I would say.
Dr. Megarian, what do you think?
You know, I think I agree with everything Tom said, and so I won't focus on those, but I like to focus on silver linings, Monica, things that are positive offshoots of this difficult event. And I think the first thing is, again, a spirit of collaboration that has emerged, I think probably more in Cleveland than any other city that I'm aware of with regards to major healthcare organizations working together. And that's amongst the three of us today and even more of our colleagues, everything related to testing, vaccination, and restarting the healthcare economy. I think the other thing is that we as a healthcare organization, all of us need to rethink our supply chains to make sure that we're not beholden to supplies that originate from areas that we can't predict the delivery. And then, you know, the acceptance now greater that was than the past with regards to virtual health and wearable devices emerging to be a bigger piece and part of our healthcare economy, I think is a positive. And then as we move from inpatient activities that were somewhat, if you will, curtailed to ambulatory and now even home, we are going to see over time, as a result of this, more facility and acceptance of home health and delivery of health in a lower cost environment in the home health arena.
Dr. Boutros, what do you think? How has MetroHealth been impacted by this pandemic, and what's changed?
Well, certainly it helped us really accelerate some of our programs. Our Institute of Hope program, which is focused on social determinants of health, it made us understand that it is now pivotal for people who are in different situations, either socioeconomic, environmental, and other situations, that they need more support than other folks, and we were able to deliver that personalized support to each one of them to make sure that they receive the best care possible. I think one of the first things that we did that really bared fruit here is putting the COVID hotline, free hotline. I think by understanding that by educating the community, by removing barriers for people who were afraid, people who may have had symptoms, we actually help the entire community do better. So it's typically not the place of healthcare systems to do that, but I think we've learned that we're going to have to step outside of the medical care structure that we currently are focused on and focus much more holistically in healthcare. One of the things that I think we need to, that it laid bare is the digital divide, right? That it has in this city. So now we all know its consequences, and we all have to address it.
Well, something else that Dr. Maholovic, you alluded to, telehealth. It was an emerging technology, but now it has become standard. And to your point, Dr. Boutros, how do we fix that? How do we make sure that if this is going to be standard of care moving forward, that we make sure everyone has access?
Well, I mean, certainly making sure the digital divide, but one of the largest issues that we had, it was the non-acceptance of telehealth by the providers themselves. We thought it was going to be substandard care. And when we were forced to use it, we saw some of the benefits of it, of telehealth. So I think overall, Tom and Cliff can address this, but we are all committed to working together to make sure that people have ready access to telehealth services, and now physicians and nurse practitioners or other folks accept it as well.
Dr. Maholovic, you want to jump in on any of that point? Because I know you as well as Metro are wiring the neighborhoods around the clinic.
Yes, we have expanded our presence in our neighborhoods by allowing the broadband access to our neighborhoods from the roofs of Cleveland Clinic's facilities. And we're very, very excited about it because as Dr. Boutros nicely said, in order for us to be able to obviously to provide telehealth, people have to have access to broadband and also access to digital devices. I would like to say that telehealth is going to be a really important way to provide care. It is not going to be the only way to provide care. It is not going to completely replace the in-person care that we provide, yet we are very, very excited about it. Currently, we're providing approximately 20% up to between 10 to 20% of our visits using virtual media.
Dr. Megarian, what's your biggest concern post-pandemic? I know University Hospitals was among the first to start the Longhauler clinic, but what are you most concerned about post-pandemic?
Well, I think going back to your earlier point, just to touch on it, I think that the digital divide, as Akram alluded to, is a very big deal. And we're participating with PCs with people to get PCs out to the folks in the various neighborhoods that historically have not had access. So certainly we want the broadband there, but they got to have a device, and that's where we're spending our time. But as it relates to your fundamental question of the long-term concerns, I think my biggest right now is the notion of folks who have postponed health care for fear of getting COVID. And, we've worked very, very hard at UH, and I know my colleagues have as well, to educate the community to make sure that the ultimate risks, in our opinion, of delaying care certainly outweigh the risks of coming into an organization like all of our organizations that are committed to safety and social distancing, masking, washing hands, et cetera. We are seeing folks come in with more advanced disease, whether it be heart disease, complications of cerebrovascular disease, or certainly cancer. And so we want to somehow either super reassure folks that it is important to keep their yearly visits with their doctors. It's certainly important to come in when they feel something is wrong. We're reconfiguring our physician offices, which we've done, to make it abundantly clear that there's social distancing, remote notification while you wait in your cars, so there's no waiting rooms, virtual options, and obviously the workaround screening. So that is my and our fundamental concern right now. Obviously, there's others. There's significant downward pressure on margins, which is causing all of us, I'm sure, to look at more efficient ways of delivering the totality of what we do. And we do have some workforce challenges, which have always remained with regards to nursing and in some other aspects of healthcare delivery. And so we want to make sure that those pipelines remain robust as we all are working together with our colleges and the universities to make sure that we participate in that stream of folks being educated and hopefully joining our workforce.
Dr. Maholovic, I know that was a big concern of yours about people delaying care, and it was happening, in the beginning of the pandemic, but is it still happening today?
Unfortunately, it is still happening today. Our most recent survey indicates that only a half of our patients who experience heart-related symptoms, so the symptoms related to heart disease, are actually seeking care at the right time. So this is clearly an enormous risk. And another risk category that all of us are worrying about is the deferral of care for patients when it comes to cancer screening. Mammographies, colonoscopies are simply not being done. People are deferring those exams, and what really worries us that we may be essentially eliminating the best way to treat those patients effectively, and the best way to treat cancer is through early diagnosis. So it is really, really important for all of the people who are watching and listening to this broadcast to make sure that they resume their ordinary care. Hospitals are safe. They should be making sure that they take good care of their health.
Dr. Boutros, Metro just started its long hauler clinic, and I know Cleveland Clinic is doing one as well. What are you most concerned about what it may reveal down the road? We've heard so much about the lung damage and the heart damage, and even cognitive damage from COVID. Are you concerned about what may come out of these long hauler clinics at all?
Well, clearly anybody with chronic disease, whether it's diabetes, Lyme's disease, there are some extraordinary sequelae that may present themselves. I guess, Mark, I would like to touch on something different than what my colleagues talked about, and I'm afraid about not the people who got sick, but the social isolation that we've had to endure for over a year today, and what the impact on our children, on our elderly. Most people didn't think about this. I certainly didn't. But the death rate from Alzheimer's disease is increasing, has significantly increased. And that's a result of people not being able to see their loved ones, not being able to have any mental stimulation during this past year. So I'm really afraid for the generation that now has had this year stolen from them, and the continued the continued isolation for our elderly. So I think we're going to see a decade of behavioral health impact of this pandemic.
What do we do? How do we address that?
Well, certainly one of the things that we need to do is to continue to collaborate. I know Dr. Maholovic will probably talk about the new program that he put together for virus detection, treatment, and the investments they made. We need to be able to do a much better job than locking down the entire world in caring for new pandemics. We need to do a much better job in pinpointing who the most vulnerable populations are, focusing on them, protecting them, and letting the rest of the world continue. I'm just honestly, that is concerning me, that we're going to be seeing impact of this pandemic for decades to come, including the lack of immunization of children that's happened here.
Dr. Maholovic, on that point, are we winning the fight against this virus? Are we even close?
We are. We're getting closer and closer. I believe that we are winning a fight against the virus. What is very, very encouraging that we are getting many new vaccines that are currently being approved, and all of them are really effective. And obviously, the mass vaccination is a challenge. This is an unprecedented challenge. We have never done that, not at the scale and at the speed that is required, but the progress is real. And I'm very optimistic about the vaccination effort in our country. And I do believe that continuation of public healthcare measures, meaning mask wearing, social distancing, hand washing, everything that we've been preaching, so to say, for a really long time, together with the mass vaccination effort, is going to get us to the point where we will have the resumption of normal life activities. And I do certainly believe and hope it's not going to be in a distant future.
Is it important to remind people, though, because I've been saying this on the news quite a bit, that vaccine is not a free pass. While it prevents severe disease, it's not getting rid of everything else. I know I'm Debbie Downer on that, but is there anything else we can tell people?
You know, my overall feeling, and I share Tom's feeling, this was obviously a very difficult time, but I think looking at the bright side, which we need to, and that helps always, we have a lot to celebrate. The notion of creating a viable vaccine within 7 months of a detection of a new strain of a virus is absolutely incredible. And the fact that there's not one, but literally handfuls of vaccines rolling out regularly, I think gives a lot of, and should give a lot of feeling that we are going to get our arms around this. But I think that your question is a good one. And that is, I don't think we should be looking for a day that we eradicate COVID. I think it will be part, but we will push it down in terms of the level of severity that it has in the human, in humanity, by a combination of both very clever vaccines that are being developed, many of which we're trialing here at UH, but also the bevy of therapeutics. So my hope is, Monica, that, you know, we always have had the flu, and flu, make no mistake, does damage to thousands of people, hundreds, tens of thousands a year. But we've pushed it down in terms of the level of, if you will, fear, because we certainly take our flu shots, many of us who accept vaccines. And we also have therapeutics like Tamiflu. So I believe that we are going to get to the point relatively soon this year where we'll have a combination of both those approaches. And I think the point that was made earlier by both Akram and Tom is that maybe the notion of safe distancing, masking, and universal precautions will become a bigger part of our day-to-day lives. And I think those things will get us past this, where it becomes somewhat of something that's in the back of our minds as opposed to the front of our minds every day.
Monica, you said, what's one of the silver lining of this? Clearly, the washing hands, watching our distances, and wearing masks has reduced influenza transmission this year so far by 99% at MetroHealth. So,
yeah.
So I've never heard of anything like this in my entire career. This sharper decline for a transmittable disease. So we clearly are learning habits that are going to be beneficial to us in the future.
One of the things I'm concerned about is the fact the variants that are coming out, and also, we've had a number of warning signs over the years from other, maybe not global pandemics, but other epidemics, including, swine flu. We had SARS, we had MERS. Is there any concern that COVID could be a dress rehearsal for something bigger?
But there is a true concern that COVID may be a dress rehearsal for something bigger. And there are two components that are really important contributing components of our age. One is the global warming, and the second one is the globalization, and it's global travel. We're more connected than we've ever been, with an exception of this past year. But global warming is a real issue. I think that global warming, which is melting the parts of the globe and the surface, in particular in the northern and the southern hemisphere, the tips of the northern and southern hemisphere, are going to uncover viruses that were frozen in ice for thousands of years, and we've never been exposed to them in the past. So yes, new pandemics are possible. Actually, they are probably going to become a part of our reality.
How are you all planning for that? Because we've done pandemic planning, but it seemed that we sort of missed a few things here and there, communication being one of them. So now that you've had a year under your belt, how are each of your institutions planning for what may come next? Or how do we continue dealing with this one and the variants that are emerging? Dr. McGarry, I'll start with you.
Well, the first thing we're doing, obviously, is being able to be on the forefront of detecting variants. And, we were one of the leads in detecting the UK variant here at our lab. So having the infrastructure so that we are very able to do viral detection and be able to do the work and necessary in identifying variants and even new virus. I think second, what we have to do is we have to get better at, I think, being able to respond to this dress rehearsal. If it is a dress rehearsal, it probably is. There will be more viruses. It's foolish for me to think that there won't be in the years to come, as there's been many in the past. And so what we have to have is ready out of the box, the ability to detect, the ability to sequester, the ability to then work with our colleagues in the pharmaceutical world to create vaccines, and then the ability to deliver those vaccines. And that is ultimately what we will do. I am not at all concerned that based on how we've responded, in the last 7 to 8 months, and how we are now going to cut our teeth on getting distribution down as it relates to vaccines, which is something that we obviously are all working on as a nation. I have no doubt when that is corrected that we will have the infrastructure and the armamentarium to respond fairly rapidly with every new entrance into the viral market, if you call it.
Dr. Boutros, anything you'd like to add?
The dress rehearsal was SARS, right? Because if SARS was had caused more issues than being a mild infection, we would have had an absolute disaster on our hands. So it affected lots and lots of millions of people in the United States, 50 million to be exact, and it was mild. So thankfully we got through that. Knowledge transfer and sharing of knowledge. I think what we've all learned is that we can be competitive in having the best programs around, but we need to be collaborative for the good of the community. And we not only have learned that in Cleveland, I think we've learned it as an industry and across industry, so that no one is going to win this fight if we keep hoarding knowledge. So I think that's where you're going to see an acceleration of response. And as far as I'm concerned, as far as vaccinations is, I know our 3 organizations and almost every health system that I've spoken to can double or triple and quadruple its vaccinations today if there's just the vaccine was available. And I think we could, make a huge impact. That the quicker that people are vaccinated, the less the chance the virus has to spread from one person to the next.
One of the things, when we went to 1B, Dr. Maholovic, I remember, I think you put out a memo that, the healthcare workers who, weren't on the front lines had to then wait for their vaccine. Are you at all concerned about any healthcare workers who are hesitant or maybe just plain refusing to get the vaccine as we move forward?
We're actually not seeing many of our caregivers refusing vaccines. There is a variable acceptance to the vaccine, but it is getting better and better. I think the real issue right now is simply a vaccine availability. And it is also really important to know that our large and complex healthcare organization that we are responsible in leading obviously have a large proportion of our providers, the largest that are in the direct patient care area. Some of them are not in the direct patient care area, but they're also very important. They're important because we cannot function without them. If let's say our information technology service gets sick and we cannot maintain our computers and electronic medical records, we cannot take care of our patients. So it is really important to underscore that there is that the broader family of caregivers is what we need in order to be able, We need them healthy. We need them in their workplaces in order to be able to care for our patients.
You all touched on this about the speed of information. You know, this obviously, I hate to, the word is trite now and cliche, but it is an unprecedented time that we're living in. How will that translate? Because all three of your institutions are paramount in getting new therapies to market as well. So how is this going to translate with the FDA offering emergency use authorization to, you know, so quickly to some of these vaccines? Do you see that changing in, you know, other diseases that we're facing right now, the ALS, the cancers, those types of things? Will we see faster therapies coming to market because of COVID?
I certainly believe so. It just like we had some significant acceptance of telemedicine among the professionals. I think you're going to see these regulatory agencies look at themselves and say, can we do something different? You also see technologies that we have been dreaming about, which is, can you treat cancer by using a viral messenger to create antibodies, and you'll see that also accelerate. So there will be long-term positive impacts here, both on regulation, I believe, on the speed of response, and also and just advancement of medicine as a result of this. Because I just don't believe that the bureaucracy that we had to go through, including receiving PPE and distributing vaccines and all of that, is going to be acceptable to the world.
You know, some of the bureaucracy and sluggishness, if you will, Monica, certainly may exist in the agencies that ultimately are the final arbiters, but some of it is ourselves to blame. All of us have our IRB, institutional review boards, that are the gatekeepers of launching even the beginnings of research. And I saw, to answer your question, during this event, even our own architecture and infrastructure speed up. So for example, during the early days of March, Gilead approached us, Gilead Pharmaceuticals, to be site 001 for the remdesivir trial, which then went on all over the world. And typically, and typically, let me just say, it takes a while for our IRB to move through that sort of examination. Well, they were able to find it within themselves to logarithmically increase the speed of getting IRB approval through our internal IRB. And now that is the standard of the day. In other words, we've reached a new, if you will, speed now without any compromise of checking things and making sure everything's safe. But I think throughout this event, one of the potential silver linings will be the understanding that there really is no room for taking too much time, and hopefully that will extend through not only the EUAs for the vaccines, but then the therapeutics, then bleed over to other important drugs that can save lives.
I think this is going to be something that the public is going to demand as well. If they've seen it done for a pandemic, they'll expect it for other things. Dr. Boutros, the pandemic and racial unrest put a spotlight on health disparities across the nation and, of course, here in our communities. So how are your systems pivoting attention to address this issue, and what is that timeline for change?
You know, I tell you, I could not be more delighted that to say, and again, my colleagues can speak for themselves, but I know that both Cliff and Tom have taken a very strong stance on making sure that we close healthcare disparity gaps. I see a lot of new renewed energy, and not only to doing project type work, but making this a lasting change in the healthcare system. And as Tom said, we're recognizing that it's not just medical care that matters. There are so many social determinants of health that we need to address for a lot of folks. And that's what the community needs from us, and that's what we're going to deliver. So for me, I'm very optimistic that we will have a great impact on racial disparities. I also think it also highlighted other things that we needed to do, which is, for example, employment. We need to focus on making sure that our employees represent the community because they're much more trusted as such. And I think Tom probably can tell you about the Cleveland Clinic signed to create 1 million jobs for Black Americans over the next 10 years. And I know Cliff has had a great deal of focus on also having diverse hiring of clinicians and staff. So this is the work we need to do together and individually and collectively to be able to make change.
Dr. Maholovic, what are some of the highlights you're most proud of? Because I remember when you first took over, you took a walk down Cedar and checked out the neighborhood nearby. And that when we first met, that was one of the first things you talked about is getting your neighborhood healthy.
Well, we certainly wanted to keep our neighborhood healthy, and we kept it very, very healthy. And we have just recently reviewed the acceptance rate for vaccine in our immediate neighborhoods, and it was way above average. Actually, it was a very, very just an uplifting statistics that our neighborhoods are actually willing to get vaccinated and willing to keep themselves healthy. What I'm really excited about as this pandemic continues to roll through its course is a few new initiatives that Akram alluded to that I believe are going to put Cleveland and Northeast Ohio in a center for the fight against this pandemic and any other future pandemic. We together, three of our institutions, as well as Case Western Reserve University and Cleveland State University jointly, have been able to attract the largest investments for job creation in the Northeast Ohio in its history, and it is in healthcare. So as part of our joint effort, we are going to create a nucleus for new discoveries in healthcare that are going to put us in a substantially better position to fight off future pandemics. Cleveland Clinic is investing, together with the state of Ohio, $500 million into the new Center for Global and Emerging Pathogens that will do exactly everything that we're hoping that some center like that would do. Would discover new viruses faster, would deliver the new treatments and vaccines faster, and then together we all will distribute them into our communities at a faster pace. And that will also not only protect all of us from future pandemics, but also will create new jobs. We certainly strive to create 8,500 new jobs in the Northeast Ohio, and very many of them are going to be exactly in the communities that just briefly touched upon. And we're very passionate about it because our healthcare providers need to be a part of the community, and we are very excited about the future.
So you're alluding also to the innovation corridor, and Dr. Megarian, your thoughts on that. Where do you see university hospitals, you being one of the newer CEOs now taking over, your vision for what is going to happen in the next 10 years?
Well, again, I hope you can tell from the spirit of our collaboration and our banter that there is a tremendous amount of trust and desire for these three community assets to work very closely together. And before I answer your question, I will say, going back to what Akram was talking about, clearly the notion of health disparities, social determinants of health, and issues related to even the disparate effect of COVID on the communities in our inner cities have caused all of us to weave together pieces and parts to become a fabric of dealing with this problem. UH has worked hard on building the Otis Moss Center in the Fairfax neighborhood, of investing significantly in the UH Center for Women and Children, specifically to address issues related to infant mortality and maternal mortality and first year of life. And we've obviously working very hard to deal with the lead issues. Now that concept and each of these three organizations are doing just as important and significant work. The beauty is it's being woven together into something that helps the community. Now, as it relates to the Innovation District, each of us have significant assets to bring to bear. And if you detail those assets, they are going to be woven together similarly like this as it relates to job creation. And UH is particularly interested in work around leading research and product innovation as it relates to global health and emerging infections, if you will, collaborating with the great work that CCF is doing. Smart health product innovation, kind of what we did during the pandemic. We worked with this company called Massimo to deliver and help get now approved throughout the world the whole monitoring system. And we have more work that we're doing. And how do we deliver these smart devices to the community? Can we then build jobs around those, leveraging our Harrington Discovery Institute, which is very active in drug discovery as it relates particularly to rare and orphan diseases, but now during COVID, close to 150 different clinical trials on therapeutics around the world, partnering with Oxford University and the Technion in Israel. And we will bring those activities to be part of the innovation district, working with our good friends, our colleagues. And we've committed also quite a bit to this effort, which not only we think is going to deliver a significant amount of new jobs as it relates to research, specifically research jobs, and we think working with Cleveland State to help train up the folks who need to be in these positions, but we will also deliver significant increases in already the research portfolio and the dollars that flow into Cleveland as it relates to research in these areas. So we're just very pleased to work with Ackerman, Tom, and Harlan and Scott Cowan from CWRU in doing exactly what we've done as it relates to dealing with disparities in health, but now dealing with job creation, research infrastructure. So I'm very confident that we will continue this great work together over the next 10 years of this project.
Monica, I know you said Cliff is the new CEO, but this past year has been kind of like dog years. So I think he's an old pro at it right now. So
yeah, I would agree with that. He and I chatted about that quickly beforehand. I have two great folks who've been very helpful. Both Tom and Akram have been unbelievably kind and generous with their time and their advice. Well, I have to tell you, it's very refreshing. I've been covering the healthcare field in Cleveland now, or Northeast Ohio, for going on 24 years. And the collaborative efforts that I've seen in the last year and leading up to that have just been really incredible. So I'm curious to know, let's take a look 10 years ahead. If job creation is, one of the priorities for all of your institutions, where do you see us? Many people already consider the greater Cleveland area the medical mecca. Is it going to get bigger? And do you think that the pandemic is going to inspire more young people to go into healthcare?
I would say that the answer to that is yes and yes. Yes, I do believe that our organizations will grow. I am absolutely convinced that we're going to create a greater impact, not only in our immediate communities through job creation, but also, I believe, a global impact. This is an unprecedented collaboration. This is an unprecedented collaboration by the entire community, our healthcare community here in Northeast Ohio. And I know that when we work together, we can really, really bring the impact to the world that we all desire to do. So I'm very optimistic.
I think an early, perhaps, harbinger of the interest in healthcare is seen now in applications to medical schools. In the year since COVID, they have gone up dramatically. In some schools, close to 50% increase in applicants. And I'm starting to talk to my nursing school colleagues. We're seeing the same thing. So although we've dealt with a relative paucity of nursing and allied health professionals, potentially another silver lining of this may be a renewed interest in this field and getting more folks involved in it.
There's nothing more noble than caring for someone, and really the frontline staff who provide not only medical care but comfort and healing to the individuals and their family. They honestly, it's just one of the most gratifying things that there is. And regarding the future, we try to attract people here by the global mart having the latest equipment, or Cleveland Clinic being the best in the world for cardiac care. That, or the Cancer Care Center at university hospitals, those attract individuals, right? I think what we're working on right now is attracting industries. So all of the things we're talking about is literally making Cleveland a hub for innovation for healthcare and technology. And by putting the power of these five institutions together, it is just an exponential opportunity before us. And if we don't do it, it will be our fault. If we do not reach greatness and making the Cleveland be the hub for everybody wanting to come here to start a new company, investigate new therapeutics, honestly, it will be our failure. It will not be anybody else's, because it's right before us.
I want to step outside of the pandemic for a second. A year ago, before the pandemic, I wanted to ask you all to predict what the most important healthcare advancement and issue would be in the next decade. What do you think it is now that we have to deal with for the next decade? Dr. Boutros, you alluded earlier to mental health is going to be a huge primary concern. What else are the things that we're going to have to pay attention to, and at least in the next decade?
Well, I think the recognition that things like adverse childhood experiences have set an impact and a course for young people, that it's very hard to, that gravitational pull towards illness is very hard to deal with if you don't deal with adverse childhood experiences. The recognition that we need to be personalized medicine used to be about making sure that you get the exact medical treatment that you need. Personalized health, I think, is where we're going to move to, which is going to look at all the other social issues that we need to help you overcome in order for you to remain healthy. So I think that's where you're going to see the evolution of, from a purely medical model or predominantly medical model to a healthcare model.
Dr. McGarren, your thoughts?
I usually always agree with Akra, but I always usually have something else to add. I think the notion of detecting issues in childhood that will rear its head in later life is the concept of prevention. In other words, understanding that there's a instigator there that may lead to a deleterious health outcome, and then treating it early. And I think that is my feeling. I think we're going to have to get our arms as a nation around the expanding cost of healthcare as it relates to the GDP. We're approaching 20%. Our competitors in the G8s are looking at 9 to 11%. Now, there's a little bit of quibbling about how you keep track of that. But at the end of the day, there's no doubt all of us have to be part of the solution in terms of creating the best value in healthcare. And my personal opinion is going to be enhancing primary care, so that we don't just go to the hospital when we're sick or the doctor when we're sick. We get used to the notion of visiting our physicians, our primary care physicians, our pediatricians on a regular basis, so disorders can be detected at the earliest stage. And as Akram alluded to, precision medicine, immunotherapy related to cancers are going to seize the day. And clearly the way to then lower the overall burden, increase the quality, lower the cost, efficiencies, is going to be enhancement of primary care and making sure that we get our arms around that cultural transformation where people realize you don't just go when you're sick, you've got to go regularly. So that's my thoughts.
Dr. Maholovic, is that something that's being focused on in the medical school?
Well, yeah, it certainly is, and I think the 21st century is certainly, in my opinion, going to be marked by a substantially greater influence of technology, computational and digital technology in healthcare, because that technology is going to allow us to access our patients in a more affordable and more effective way. It is going to allow us to provide treatments that are going to be individualized, and ultimately they are going to allow us to really establish that continuity of care that Cliff just mentioned. Traditionally, in the 20th century, healthcare was limited to episodes of care. People sought out medical care when they became ill. What we are learning very, very quickly is that we really need to focus on having a lifelong engagement between patients and healthcare providers. And technology is going to allow us to have that type of engagement, but is also going to allow us to have a much more personalized approach to an individual that is going to be tailored to their needs, to their environments, to their specific circumstances. And that's why all of us are so excited about the future of healthcare.
Quickly, I know we're getting short on time, so I wanted to ask you, one of the main things I'm getting asked about is the difficulty for people to get a vaccine. Any words of calming you can give people, what they need to do, how they, your thoughts on the rollout and the governor's plan on distribution? Is that the correct way of doing it, or do you think things need to be changed?
Well, I could
think
go ahead, Akram. Yeah.
I think the governor is doing the best job he could with the limited amount of vaccines we have. There is no right way to do this. This is you have to figure it out as you go along, and you see where the highest risks are, and do that. I can say to you, you want calming words. I would say is that you will be vaccinated before you know it. It's I know it's going to seem like a long time for the new vaccines to come on board, but they are coming on board, and we'll be utilizing them. And just have the confidence is that when it's available, we will vaccinate you. The healthcare system is ready to do its part to vaccinate you.
Dr. Maholovic?
Well, we are certainly living in a time when vaccines are coming in short supply, so we have to realize that there are millions and millions of our fellow citizens who are still patiently waiting for a vaccine. So these are difficult times, but I would like to assure everyone that this too will pass, and it will pass very quickly. New vaccines are coming up with a speed and a pace that is unprecedented. And let's just take a journey back in time. A year ago, we were struggling with testing for COVID. Right now, nobody worries whether they can be tested or not, because testing is available everywhere. I am absolutely convinced that within the next few months, we're going to have new vaccines and a sufficient supply of vaccines that we will be able to vaccinate all of those in need.
Dr. Megarian, are you thinking that the COVID vaccine is going to be something that we're going to have to deal with just like a flu vaccine each year?
I do, and I think the pace of the variants that we're seeing emerge is such that it will probably be very much like the influenza virus, where every year we have a new subspecies, a new variant, and that drives the vaccine development, and then that is what we get as a shot every year. And I absolutely believe that we probably will get to the point where we'll get, if you will, a cocktail theoretically every year, both the latest COVID vaccine as well as the latest influenza vaccine. And I think it'll be part of our world. But I think it'll be tamped down to a level where it won't be literally on the front pages every day, because we'll get our arms around it, hopefully with better therapeutics. I think it is naive to think that a vaccine will allow complete protection. We're aware, all of us, that whether the flu vaccine is 60% or 70% or 80% effective every year, we all have breakthroughs, but we've developed therapeutics to minimize the complications. And I think that's where we will be living in the years to come.
I want to just do one final round robin, if you will, and let you all discuss any final thoughts you have that you'd like to pass along to our viewers. So Dr. Maholovic, I'll start with you.
Well, I think this has certainly been a trying year, as we said, but this has also been a year when we came together. I would like to say, although it was trying, we have really, we witnessed a phenomenal phenomenal success in finding and developing vaccine for a brand new illness, for illness that we never faced before in a record time. We're getting vaccinated. We are getting into the phase, I think, of pandemic where we're going to see the number of those who are getting sicker and declining, and I'm very optimistic.
Dr. Bouchos?
Well, I would say is that even though this has had enormous impact on us individually, and many of us have lost loved ones to COVID and to other diseases that were not treated, I would say it has also been a reset for our nation and our community to figure out what's in front of us and to be laser focused on being better, delivering faster results, greater results for our community, thinking beyond ourselves, beyond our organization. So I am, I think this will mark in my career the tipping point where a collaboration overtakes competition.
Dr. McGarrian?
Many people, Monica, say that the mettle or the fortitude of a entity, in this case we'll call it the Cleveland community, is measured not on how it performs during periods of tranquility, and it's more measured during how it responds to significant stress and uncertainty. And by almost every measure, the way Cleveland and Northeast Ohio quickly embraced masking, how we listened to our governor very, very quickly, how we collaborated as healthcare organizations to step up testing, how we collaborated and did not worry who's who, what's what, we all worked together. I think that makes me so proud of Cleveland and the Cleveland community, and certainly the healthcare community. And as a result of that, I think the dust settles, we should, as citizens here, feel very, very confident about the culture and our ability to work together and get things done. I am very proud and honored really to be part of this greater community.
Doctors, thank you so much for your time, and thank you for your staffs as well. They have done amazing work in the past year. And as speaking for a resident and one who uses all three of your systems, I'm very, very grateful and appreciative of everything you all do. Thank you again, and hopefully we will chat again very soon.